Good afternoon, everyone. Yeah. Good afternoon, everyone, and thanks for joining in for today's session. Uh, this is one of the most awaited sessions of the Local Evaluation Week 2022, which is the Datathon for Development. And this is a very awaited event as this has been a nationwide call for papers which are data driven, and we are hoping forward and we are looking forward to learning a lot from the presenters for today. And I would like to now invite Dr. Ashish Desai, who is a director here at DMU, for his welcome address. Thank you.
Thank you, Aishwarya. Uh, Thank you all the participant and our discussion, Dr. Abhay and Dr. Ashok Thomas. So in the past few years, as we have seen, data has been growing and technology-based monitoring and evaluation is gaining prominence. The use of data goes beyond economic evaluations to also identify social impacts and infrastructure impacts. Building on the existing definition of ICT, we aim to, this contest tries to look at how data-driven policy making can make a difference. With that objective, we organize this Datathon for Development, which was an open call for papers across the participants, primarily in India. We had an overwhelming response for the contest. And first of all, I should appreciate and compliment all the presenters because these who are participating from the overwhelming entries that we had. Sincerely, thank you for taking all the efforts and submitting this. We hope that our eminent panelists' feedback and discussions will help you fine-tune your papers and then subsequently take it to a publication. If we can be of any assistance towards the journey, we would be more than glad to support you. So this analysis and these papers that are being presented are primarily the question, the data, as well as the research hypothesis and recommendation is opinions/recommendations of the participants. And the views expressed to them are of the participants themselves, not of local or DMO Niti. Now, let me introduce our two eminent discussants. First, is Dr. Abhay Kumar. Dr. Abhay is currently working as head of Evidence and Results Unit at the United Nations World Food Programme, India Country Office. In his current capacity, he works in close partnership with the national and all the states government to strengthen their capacity in M&E. He has completed number of research and evaluation projects supported UNWFP, UNDP, National Commissions on Minorities, Planning Commission, Ministry of Rural Development, Ministry of Human Resource Development, etc. Abhay holds a PhD from Jawaharlal Nehru University, New Delhi. Thank you, Dr. Abhay, for being a part of the discussions and on the panel. Welcome. Now, the second discussant is Dr. Ashok Thomas. Dr. Thomas is a professor at IIM Kozhikode since 2016. Prior to this, he was a research fellow with University of Pisa and consultant MEFOP Rome. His research interests are savings and portfolio decision making, financial literacy, cognition, economics of pension fund, and socially responsible investments. He has a number of publications in A and A-star journals to his credit. Dr. Thomas is a graduate in economics from Madras Christian College, postgraduate in economics from University of Hyderabad, and holds a PhD in economics from University of Pisa, Italy. Thank you, Dr. Thomas, for joining us, and welcome to the panel. I now hand over back to Aishwarya to start the proceedings. Thank you very much, and all the best.
Thank you, Ashish. Now, very quickly going over some of the housekeeping rules to be followed during the session. So as discussed earlier, each participant will have a total of 7 minutes for their presentation. At the end of 5 minutes, we would be telling you that you have 2 minutes to wrap up the rest of the presentation, which will be followed by 5 minutes of discussion and feedback by our esteemed panel and discussants. And in case the audience has any questions, we would request them to please post it on our chat box, and we have a dedicated time at the end of all the presentations for the discussion on the same. Thank you. Now, quickly, we will begin with the first presentation. The first paper to be presented today is using public data for solving location allocation problem in public health. We would request the team to please start the presentation. Thank you.
Yeah, hi Aishwarya. We request sharing access so that we can present our slides ourselves.
Sure.
Yeah, Sushant will share the slide from the team. Sushant Sona.
Sure. We are doing that as we are speaking.
Yeah. Good afternoon, everyone. We are Team Vishleshan, and joining with me is Surbi, Sushant, and Tanya to present our paper on use of publicly available data on solving location allocation problem in public health. As we all know, uh, providing quality healthcare is a key responsibility of local and state government. But if you analyze the government spending, it is visible that healthcare is not a priority. And this is also reflected in the healthcare indicators. And if you dig deep, we will realize that there is a stark difference between the health indicator and access to healthcare facilities in the urban and rural areas of India. Literature suggests that the three key component which impact healthcare indicators is availability to service, accessibility, and affordability. For the scope of this presentation, we will focus on spatial accessibility to a healthcare facility, which means the distance from the particular location or town to a particular health facility. And as the out-of-pocket expenditure of pursuing this health service in a private care facility is extremely high, it is very important to have public healthcare facility in the vicinity of a population. Uh, in literature, it is very clear that there is a association between how far a health facility is located to the health indicators of a community. On average, if any village which is within 5 kilometers of a health facility shows better healthcare indicators than those who are located outside. To improve the healthcare indicators, it is very clear that there has to be public healthcare facility in all pockets of areas. To set up new healthcare facilities, the question then remains, how do we select a particular location that will be giving maximum access and efficient utilization of available public health resources. So what we are presenting here is, through this paper we are highlighting a method to solve for this location allocation problem of setting a new public health facility. Uh, for the for the for the for this paper, we are taking a case of UP as a state where the government has decided to set up 5,000 new sub-centers. Sub-center is a first public health facility nearest to the population. We hypothesize that a data-driven facility location tool will eventually help in identifying service accessibility gaps and ultimately help in finalizing the best location for the efficient resource allocation. Through this paper, we will demonstrate how we will visualize the access gap using GIS tools and how we can solve for this problem. The methodology we followed was creation of a GIS visualization layer to map all existing health facilities in UP within the administrative boundaries of district and all, and using publicly available data of census and village location coordinates, we'll show that how a gas can be accessed. We are taking two indicators to access this gap. One is your service area of each sub-center, that is to cater for each 5,000 population. And second one is the distance from a particular village or gram panchayat to the nearest sub-center. What we'll show in the method is how we have accessed this gap, how we have highlighted this gap, pockets of gap, and how we can solve for this problem. Whenever the state has to allocate new subcenter, what is the efficient way, what is the criteria based objective method to look for this, to determine the best location for the subcenter. The data that we have used to solve for this problem is a state level public healthcare facility data that is available on Directorate of Medical and Health Services of UP. We also,
Excuse me, very sorry to interrupt, but your 5 minutes are up, so please quickly wrap up your presentation in the next 2 minutes. Thank you.
this is the data. Over to you, Sushant.
So as you can see on the screen that this is the map of UP where the red dots displays the subcenters which were in UP. Previously there were around 20,000 subcenters across all the districts, 75 districts. So we, as seen on the table, you can see the projected population as per 2020, the number of existing subcenters, that is 20848, and the current gap, that is 15019. But due to allocate to reduce this gap, the UP government has decided to launch 5,000 new subcenters. So as you can see, this is across the blocks. So as you can see, this is for the district Ambedkar Nagar. The left side table, you can see the district Ambedkar Nagar and the block Bhiti. The projected population for this is 23,78,976. That is for Ambedkar Nagar district, and for the Bhiti block it is 1,95,000. So the current gap, as you can see in the fourth column, fourth row, the current gap allocation is minus 70. That is 17 new subcenters to be allocated. As per the 5,000 new subcenter allocation, the Ambedkar Nagar district needs 44 new subcenters, out of which 4 were allocated in Bhiti block. As you can see on the right side of the table, the highlighted the first 4 subcenters. As you can see on the map, that the left hand side map shares the subcenter allocation, the previous subcenter allocations. What we have, there is a number 22. 22 subcenters were there in Bhiti block, and on the right side you can see the pockets where the blue color is displayed are the previous ones. The yellow is the new subcenter allocated as per the distance and population criteria. So these are the farthest from any population catered as per the previous subcenters, as per the previous allocations. So this is as per with respect to the previous calculations. We have done this for the Bhiti block, Puranpur block from Pilipit district. The yellow are the new subcenter allocations as per the Gram Panchayats where no subcenters were allocated previously. So from this we have found some findings and insights.
So while doing the study, it was clearly visible that districts on the periphery have visibly lesser number of health facilities as compared to other districts, and implying administrative and revenue boundaries play a role. But this decision making can be more structured, more inclusive, and so we believe criteria-based decision making process, such as the one suggested using GIS tools, would lead to unbiased and need-driven decisions. We also found out that based on the location allocation method.
Excuse me.
Yeah.
Really sorry, but your time is up, and we need to take up the discussion right now. So thank you so much for your presentation. But now I would like to call upon Dr. Ashok Thomas for his views on this paper? Dr. Ashok, can you please come in?
Just a question. Was the timer started when the presentation started or before that? Because you just need like a 30-second to conclude it.
Okay, fine.
Yeah, sure.
Please go ahead.
Yeah, thank you so much. So concluding, we'd just like to say that the location allocation method as suggested requires verified data, huge amounts of data, and for that data visualization, tools are incredibly important, making it faster and easier. And we acknowledge that this method can be used in large-scale projects such as Ayushman Bharat Health Infrastructure Mission, which is focused for better healthcare infrastructure of the country. Location allocation is one of the many methods, but just concluding, I'd like to say that it's a crucial one since, as David Goodman said, in health, geography is destiny. Thank you.
Thank you so much. Now, requesting Dr. Thomas to please present his feedback on this presentation. Thank you.
Dr. Thomas?
Dr. Thomas, if you're speaking, you're not audible. Requesting you to please unmute yourself now.
Maybe there is a issue.
There are some.
So maybe Dr. Abhay, if you could.
Sure. Can you hear me?
Yes. Thank
Yes,
you.
Dr.
Yeah. So, in fact, couple of pointers here. So just wanted to cite, first of all, I think I must thank and congratulate these young scholars, Surbhi, Sushant, Tanya, and Umesh for bringing out this, amazing solution for it's a kind of policy solution to a challenge of how to locate our public health infrastructure. So thank you so much, all the researchers involved into this paper. Use of GIS has taken place uh, substantially in the past, maybe a decade or so, particularly into the healthcare management and healthcare planning. So just for your information that, the today, most of these, not only the sub-center or the PSC, but even the medical colleges are also getting, decided on the basis of all these location factors. So there are numerous literatures. If you go through the website and the journals, you'll find that now GIS has become a big tool to suggest on the location of the GI location of the public health care infrastructure. One point what I'd like to say that, when we discuss about the location, one of the challenge that we face is that I wanted to see here you transposing the population density in this GIS map together with the subcenter which you are suggesting on the basis of the location. So if we transpose the two, I think you will get a better results, because I see in the mountainous region many of the time, if you decide the subcenters, because many of the smaller location in the mountainous region, they're all very located very at a very at a bigger distance. So for them it becomes a big, particularly for the mountainous region, this location becomes a big challenge. So I will suggest you to please try to transpose the density also together with the location that you are suggesting. I think it will bring a good paper. But I'll stop here. But I must appreciate the efforts that you have made, and please try to expand your thoughts and ideas further so that you can take it to the next step.
Thank you so much, sir. Thank you so much. Yeah. We'll incorporate the suggestion suggested by you. Thank you.
Thank you, Ashok. Dr. Ashok?
Okay, I think there is a technical issue at Dr. Ashok Thomas's end, but till the time he comes in, I have got a couple of observations. First of all, I echo Abhay's sentiments on the way that exercise was conducted. There are a couple of, and importantly, that transposing the population will give insights which would have a different perspective. I would suggest you might also want to look at two other data dimensions that one could from emerging from this. First of all, try to look at GDP and income and superimpose on a population, because affordability of public health care and private health care and needs and wants would be different. So that could give us different perspective. And also in that, if you have the data, one might want to look at private doctor density in those geographical areas. Second point, as Abhay mentioned, when you transpose a population, you might observe that population clusters are different from administrative clusters. And if population clusters are different from administrative clusters, then locating of a PHC possibly could have to follow a different barometer. So that would give a different insights. And lastly, explore from a perspective of a distance that would be able to be covered by outreach program of like ASHA worker, because that is also from a preventive healthcare, that is also an important dimension. So those were the feedback from my side, but complimenting you, thank you very much.
Thank you so much, sir.
All right.
Dr. Ashok, if you are there. Okay, I guess we have a technical challenge. Let's move to the second presenter.
Moving on to the next presentation, which is a study of initiation of postpartum family planning in India based on NFHS 4.
Yes, ma'am.
Would you be presenting, or you would want us to share?
I would like to share my PPT.
So,
if you will allow, I want to share my PPT.
yeah, we are doing that as we are speaking. Thanks, Pragya.
Allow, share.
Pragya, try sharing your screen now.
Yeah, is it visible?
Yeah, it's visible.
Okay. A very good afternoon to everyone present here. Myself, Pragya, Assistant Professor, Himalayan Institute of Medical Sciences, Dehradun. First of all, it's a great honor to be here among you all. I, along with my co-presenter, Dr. Id Ujwal, thank you for providing us this opportunity to present our work at this platform. So without wasting time, let's start. Our topic of today's presentation is a study on initiation of postpartum family planning in India. Does urban poor differ significantly from rural? So first of all, what is postpartum family planning? It is defined as the prevention of unintended pregnancy and closely spaced pregnancy through the use of contraceptive methods within the first 12 months following a childbirth. If we look at some statistics, we find that in 2015, almost half of India's, that is 48.1 million pregnancies were unintended. 11% led unintended, 11% pregnancies led to unintended births, 5% caused miscarriage from those unintended births. Also, the World Family Planning highlights that more than 1 in 10 married or in-union women have an unmet need for family planning. One of the study also said that family planning can avert more than 30% of maternal deaths and 10% of child mortality if couples space their pregnancies more than 2 years apart. So basically, the rationale behind this study was that as National Family Health Survey do not analyze and publish the results of postpartum family planning. So we took this step, as postpartum women are among those are with the greatest unmet need for family planning. And what we have tried to do here, in NFHS, the residence portion is divided in two sections, that is the urban and rural. So whatever policies and actions are taken, they are taken for rural, considering them that they are more at disadvantaged position. So with the increasing trend of urbanization, we can also see that there is an increase in urban poor residents. And when we compare these health of urban poor with rural, what we find is that they are also equally undernourished, or even at some places we find they are worse than rural. But this disparity is generally hidden behind the urban averages. So in the light of above factors, it is worth noting that visible progress of urban areas as a whole does not reflect as the true picture of the progress achieved by urban. This is the conceptual framework of a study. We have taken these factors which are affecting the postpartum family planning. We'll discuss this in detail later. Now, analysis strategy. What we have made our own definition, and then we have compared our estimates with the estimates of Planning Commission. In demographic health survey, it collects information on household assets and gives weights or certain factor scores to these assets, and on the basis of a standardized score is created, on the basis of which we divide the wealth quantile as poorest, poor, middle, rich, richest. And with the help of that definition, when we have compared our estimates to check the consistency of our estimates with Planning Commission estimate that was obtained in 2012 by Tendulkar methodology, we can see a little variation because our estimate is based on the data of 2015-16 and Planning Commission's estimate was of 2012. And within the time period, we can see that there is an increase in urbanization. So obvious that rural population will decline. So our objective is first to identify those women who have used any method of family planning or contraception within the 12 months after childbirth. And our other objective is to find the initiation, that when they have started this use within 12 months, and then a comparison between rural and urban women. Data source is obviously we have taken our data from the 4th round of NFHS that was conducted in 2015-16. And we have focused recent birth and then taken a 12 months follow-up period. The methodology that we have used here is past 5 years. So we have followed those women who have given birth in the 13 to 60 months of calendar so that we can get a 12-month follow-up. And since we are talking about duration, we have proceeded with survival analysis here. And also the month is recorded. Suppose a woman says 2.3 months, so it is recorded in the nearest one, that is 2 months. So we get the time in discrete as a discrete unit. So we have applied here a multi-level discrete time hazard modeling to model our duration to adopt spacing contraception. Now I would request Dr. Ujjwal to proceed with the results section.
Thank you, Pragya. Without wasting time, I would like to proceed with the results of our study. From this slide, it is clearly seen that within the 2 months after childbirth, there were 16% women using modern contraception and 2% women using traditional method of contraception. And when we move forward after 6-month follow-up period, the same proportion becomes 29 and 6%. And after the period of 12 months, it is found to be 37% using modern contraception and 8% using traditional contraception. And in the next slide, we have presented the disaggregated month-wise postpartum family planning use among urban poor, urban non-poor, and rural women. And here we see that there were 55% urban poor women that were not started any method of contraception during the postpartum period, whereas the same proportion among the rural women, it is found to be 59%.
Yeah, your 5
Now,
minutes are up. Thank you.
okay. Now, coming over the results. After the 12 months of follow-up period, we find that there were 19% women were using modern spacing method and 18% were using limiting method and 8% were using traditional method, but we found that there were around 3% women who experienced pregnancy during the follow-up period. And when we deeply analyzed the pregnancy and the termination, we found that there were 3% women who currently got pregnant after the recent childbirth, and out of those 45% of pregnancy resulted into miscarriages. And it is worth to mention that the 13% of those pregnancy happened in the first month of pregnancy. In this slide, we have shown in only important covariates that were associated with the start of contraception during the postpartum family planning period. Here we have presented only the hazard ratios for the urban poor versus rural, and accept the caste variable from each of the other variables, we can see that there is the extent of the effect of every variable on the start of contraception during the postpartum period is lesser among urban poor as that compares to rural women. So we can conclude that the urban poor are more vulnerable for not starting the contraception. Now I would like to bring your attention on this slide particularly because we have shown the predicted hazard for the primary or secondary educated women. Here we find that those women who are not availing any services like ANC, PNC, and institutional childbirth, here we see that there is no significant difference between the propensity to use a contraception during the postpartum period in the third figure. And when we see that those women are who are meeting with the health personnel and but not getting the family planning counseling in the first figure, here we see that there is no significant difference between these two. But as soon as they are
Excuse me,
using
ma'am.
all the huh?
We have
Hello.
already extended the presentation time by over a minute, so we would request you to quickly wrap up the rest of your presentation in the next 30 seconds. Thank you.
Okay. From the previous slide, I would like to recommend that there is a indifference in the urban poor population towards the family planning counseling. The other thing is uh, many opportunities are missed by the family planning health personnel to educate women at the time of when a women is coming to at their place for ANC, PNC, and institutional birth. So there is a need to frame and design the targeted intervention which are specifically designed for the urban poor women. Those are more vulnerable than as compared to rural women. And in order to achieve the target of SDG
Thank you.
20.
Thank you so much, ma'am. Now I would like to call upon Dr. Ashok Thomas to please give us his feedback on this. Thank you.
Yeah, thank you. I hope the internet stability is stable over time. Now, quickly, two, three comments. Very interesting paper, first of all. Congratulations to the group. It's difficult to do a survival analysis, and you have done it, and the methodology looks all fine. But my concern is regarding rural, urban, and urban poor, right? Why is that? Did you basically do a t-test to basically find out whether the urban poor is the same as the rural? Or is there a significant difference in the wealth quintiles, first of all? Second thing, you actually use the same methodology in the geography, all right? So how is that you are basically, categorizing that urban poor, and rural? How do we basically make sure that these three groups are distinct, right? Especially rural and urban poor.
Sir, we have constructed the poorest and poor quantile in the we have disaggregated the urban sample into the on the basis of national wealth quantile. We have uh, divided the poorest and poor quantile into urban poor section, and other rest into urban non-poor section, and we have not disaggregated the rural population, and we have compared the stability of these estimates with the Tendulkar methodology planning commission estimates, and it is found consistent. We have used three definition, but ultimately we found with this definition is the most suitable one.
So this paper more or less works on the supply side, right? It works on the supply side. What is that factors which basically causes women to basically have safe contraceptive practices? So there was also some awareness we have talked about, right? It's the initial part of the discussion, awareness, which is a demand side variable.
Yes, yes.
How do we basically incorporate this into your model, especially on your survival model, your demand side variables, awareness, usage of all this? How do we basically incorporate this?
Sir, we have incorporated the awareness of these matlab, whether the women are exposed to the any media like TV, newspaper, or print media, and we have also used the PSU level variable, whether the women are facing any difficulty to reach at the health center. So in this way, these issues are matlab, tackled.
Okay, okay. So at the end of the day, very interesting paper. I believe you can work a bit on your literature review to basically support your hypothesis. We don't see any literature backing up, not very few literature, which is again very old, 2001, 2003 and all that. So I require a little more fresh literature as to basically see the supply side and demand side aspects of contraception among women in their postpartum. This is my
Sure, sir. Sure,
right.
sir.
So that after the introduction, you have to push the literature and arrive at the hypothesis and arrive at the gaps more convincingly, right? Right, and then that's fine. I mean, also I would suggest you to basically have a preliminary observation data to arrive at your hypothesis. Thank you so much.
Thank you, sir. We will
Thank you,
do that.
Yeah. Thank you, Dr. Thomas. Now I would like to call upon Dr. Abhay Kumar for his feedback on the same.
Thank you. In fact, yeah, I mean, I'd like to again congratulate Ujjwal and Pragya for a wonderful work that you have done. You have wonderfully analyzed the NFHS 4 data to look upon the postpartum family planning contraceptive behavior. So congratulations for that. Yes, this paper, I'm not sure if you both of you or one of you are from IIPS, because this is a very typical paper that we find from the IIPS side. And you know, so when I was reading it, I was just trying to see, you know, it is just another paper on the IIPS. So yeah, I mean, the paper, you have approached it very well. The confusion on the urban poor and the rural poor is of course getting reflected in the paper, as Dr. Thomas says. So maybe you can build up on that and you can finalize this paper. But overall, I liked your analysis, I liked your approach. One of the thing which I was a bit doubtful, you know, because you know we are working on this datathon for MNE. So from that perspective, I did not find it a very good fit for this particular theme. But overall, the work that you have done is splendid. The efforts that you have put is very nice, and thank you for that. Over.
Thank you so much.
Thank you, sir.
Thank you so much.
Thank you. Just to echoing Dr. Thomas, Ashok Thomas, and Dr. Abhay's comments, it was a good methodology, but possibly you might want to look at M&E and look at trying to structure the causal relationships. And maybe as Professor Ashok mentioned, literature review, because it leads, one of the reasons also of causal effect is the empowerment. So you might want to explore empowerment theories such as Naila Kabir's paper 1999 to explore what is from a factors of empowerment, because you may see some correlation between socio-economic dimensions and use of contraception. So again, echoing the same thing, please do some little bit more literature review and explore causalities. That would help in MNE. Thank you very much, but congratulations.
Okay, thank you, sir.
Thank you so much. Thanks all the panelists and the discussants for your feedback. Now moving on to the next presentation, which is a dynamic model to understand implementation of central government schemes through tracking local ecosystematic factors. I would request the team to please present. Would you like us to have the presentation, or would you like presenter rights?
Yes, please share the presenting rights with us.
Yeah.
So we'll be sharing the screen also.
Already
Sure.
shared.
Thank you.
I'm not able to share my screen.
Just give us a minute. We're doing that from our end.
Would like to check if it's visible.
No, it's not visible for us. Manmeet, could you please try again?
Yes, Manmeet, it's visible now.
Right. All right. Just would like to check, is my co-author Rashi audible as well?
Yes.
All right.
Okay, thank you. I hope you'll excuse me, my video doesn't
Can you put it on full screen slide share mode, please? Yeah, thank you.
Sure. So hello everyone and good afternoon. Thank you so much for this opportunity first of all. Today a few of us from Team Sambodhi hope to present a way we can better understand the implementation of central government schemes by developing a dynamic statistical index, and we do this through a case study of PMMBY. So our entire paper is based on 3 core ideas, and first is that no policy or program is an island. It's not isolated. It exists as part of a synergetic system like a forest. And just like plants, when plants don't grow, we generally don't blame the plant. We often ask, has it received enough water? Has it received enough sunlight or nutrition? Manmeet, next slide. However, when it comes to governance, and rightly so, we often blame the government. It often leads to strife between central and state level governments. But perhaps it may also help us to actually ask whether this plant or this program policy plant has received enough nutrition in terms of enough political will, enough funding, enough social nutrition or developmental infrastructural nutrition. So we need to take an ecosystemic approach. And so when it basically comes to questions of accountability, what is important for us to do is actually take this ecosystemic perspective into mix and make our MES systems responsive to the systems within which policies or programs exist. Only then can we, and when we are able to ask these right questions, we will be able to feed in the right kind of insights into our programs, and our policy plan can grow into a policy tree. Manmeet, next slide. So basically, these are macro level ideas, and these are not unfamiliar. However, to practically examine these, what we did is we zoomed into the PMMB, Pradhan Mantri Matru Vandana Yojana scheme, and we tried to understand what are the local ecosystem factors that influence the scheme, and to what extent do they kind of contribute to program implementation, which has the most impact, and whether these kind of systemic variations have an impact on state level program performance. So for this, we developed an index called the Pradhan Mantri Matru Vandana Yojana Implementation Enhancement Index. And this index basically is kind of salient in the way that it is multidimensional in nature. It takes a 360-degree perspective. It makes use of public intent data in order to promote transparency. Ultimately, it hopes to kind of provide systemic gaps and provide a diagnostic approach to streamline policy. And we actually are proposing this index as a product of sorts that can help us, that can help different institutions basically absorb it as a product, as a dynamic and scalable product. Manmeet, next slide. So we did a basic literature review of what are the ecosystemic factors influencing PMMB by implementation. But before we get into our literature, I'd like to speak a little about the context. For those of you who are unfamiliar, the PMMBY scheme is basically a conditional cash transfer scheme for pregnant and lactating women. So if someone has been was employed but has suffered a wage loss, they usually receive an installment of 5,000 rupees for pregnant women from low income families. And basically this comes out of the assumption, or actually the scientific fact, that women who that during pregnancy we are at a critical stage, babies need enough nutrition to avoid stunted growth. Manmeet, next slide. Over to you.
Thanks. So when we try to look at the implementation of a scheme, the first thing that comes to our mind is, how is actually the government playing its role? We try to look at the supply side, whether funds are sufficient, whether it's being implemented in an efficient way or not. But if you want to look at the current data, you see data may or may not be sufficient, or it may not really talk to each other. The current data available. So you try to look at proxy indicators, which might come from the demand side or from the output or the outcome side. So for example, whether the women are they even enrolling themselves for such a program or not, or whether whether the health and the nutritional parameters are improving or not. So when you look at all these indicators together from different dimensions, these are all interactive and independent. So these boundaries are porous and they disappear when you look at it a holistic view. So, and that is how they constitute a complex system. So since we have developed this pi index, I would like to take you through to what all it can really achieve. So it can give you a 360-degree view, because we are not just taking input and output indicators. It is going much beyond. It will help us identify the gaps in the present scenario and what can really be done to improve them and fulfill the lacunae and achieve better outcomes. Similarly, it can be it is a diagnostic and a prescriptive tool, because you can know where are the leakages, and you can even with coming time, as you get more and more data on this, you can incorporate predictive analytics and forecast modeling. Similarly, the index is dynamic and scalable. Why? Because as of now,
Manmeet, your 5 minutes are up. Please wrap this presentation quickly.
the index is scalable, and with more data, it can be even made dynamic. Talking about the methodological approach, we adopted a very standardized procedure. We looked at the literature, identified indicators and proxy indicators, ran correlation tests, dropped the indicators, and finally made up the index using the methodology same as that of NITI in its multidimensional poverty index. We also ran a test of association to check which were the significant contributors. Now, one could advocate, why don't you do a principal component analysis or a multinomial or a regression kind of a procedure? We'll come to the cons of it later in the discussion. Using the current methodology, we used these data sources and came up with 7 domains and 20 indicators. Now, the only limitation of the current methodology is that the scope is humongous. We can expand the data sources, we can expand the data points. So these are the 7 dimensions: economic development, governance, geography, health, social, ICT, and all. These were the top level findings. So we basically divided the the index score, overall score, into 3 categories, tertiles I would call them: tertile 1, 2, and 3, and these were the respective distribution of the states in these 3 categories. Now, if you look at the map, you will see that probably this this tertile distribution is not able to capture much of the variance among all the states. Where is the variation? Why these states are performing similarly? So we suggest that adopting a quartile or a pentile distribution would perhaps better be able to capture the variability and yield better visualizations. And as per the test of association, the overall pi score was significantly influenced by 7 of the indicators like we have mentioned here. And we also see that South Indian states have performed better than the other states in the country, while the Bimaru states, or the states falling in the Ganga Brahmaputra basin region, they have performed poorer as compared to the rest of the nation. Why? Because in 5 of the 7 indicators, their average of these significant indicators was lower than the national average. So what does that mean? It shows that 4 out of the 7 umbrellas, health, ICT, social, and implementation effectiveness, they were most important in determining scheme performance. And what makes the toppers top and the laggards lag? Again, these indicators which fall in these umbrellas. So for example, something like strong governance and social support for women is seen to be better in the South Indian states.
Manmeet, we have given an extension of 1 minute to your team. Quickly wrap this up in the next 30 seconds, please. Thank you.
Yes, thank you. So we see that in states where the health department is implementing the scheme, and the states where the WCD department is implementing the scheme, there we can see a difference in the performance or the index score in those states. Now, what could be the way forward? One, we are open to making this methodology more robust, because we know there are inefficiencies in this. Number two, whatever assumptions or the hypothesis we have made, we would like to do a ground truthing by two ways. One, we go to the field, do some qualitative study, and two, by looking at the present secondary data that we have already used in the index. Thank you, and I open the floor to the discussants.
Requesting Dr. Thomas for his comments.
Thank you. Very interesting paper, first of all. Congratulations on that. You have touched upon a very important subject. And so you start with basically the complexity of the systems, and later you find out that the demand side factors are more interestingly affecting the decision, right? So, but let me ask you a few questions. One is regarding which is the year and why you have chosen this year? One. Okay, so just you can answer later. Two is that I feel that, once we started the motivation of the story, then when it comes to the
Sir, are you there? We lost you.
We just lost you. Hello.
Maybe we just go.
Dr. Ashok, we'll take up your comments later. We'll move on to Dr.
You are also muted, Ashwarya.
all right. So that's one of the comments. So, which makes it a little weaker. And when you start with the motivation, that's part. Second thing.
Sorry, Dr. Thomas, we can hear your comments.
Oh, I'm sorry. There's a problem down there. Can you hear me now?
Yeah,
Yes,
you're better now. It's
yes.
better now. It's fine.
So I was telling that though you started the motivation of the story really well with talking about the supply side, and then you talked about the literature review, enablers and barriers, there is no citations of any of those arguments, which is a kind of bit surprising, right? So when we write a research paper, it's important that we at least bring the literature review based on developing countries, especially on a broader front. I'm not telling about what is on PMY, right? That's not the case. But on what areas, let's say, awareness talks about influencing services which is being provided by the government. How does it reduce e-corruption?
So starting with your first question, that which year data did we take? We took NFHS 5 data 1921, and similarly most recent data most probably from the year 2019 to 20 and 2020 to 21. So data was taken for these years. And regarding citing literature, we have shortly mentioned it in the paper that we had shared, but we missed putting them in our deck.
About the year, which is the year you have basically chosen for the this thing, and why did you choose 7? Can you hear me?
Yes, sir, I can hear you.
What is the year of this analysis?
So NFHS, we have taken NFHS 5 data, and for the other indicators, we have referred to the data points from 2019-20 or 2020-21.
Okay, one more small suggestion, Manmeet and team, is that when you basically present the independent variables, I also require some kind of backing of those independent variables. For example, when you talk about intra-household decision making, how does it basically influence your dependent variable? Okay, that is where the paper lifts itself. So it's a brilliant idea, but has to be worked on. Thank you.
I would like to just say one thing on that, particularly on this indicator like you have flagged. So for example, an indicator like intra-household decision making. So for example, if I'm one of the beneficiaries and if I've got my first installment of the monetary benefit that the program promises, so it's in the installments of 2000, 2000, 1000 in 3 installments. After getting the payment of the first installment, I see that my husband really didn't allow me to use that money for my own medicines or folic acids or stuff like that. Instead, my husband, he just took the money and had alcohol out of it. So I may decide not to apply for the second and the third round of it for the of the installments. So if I have that power to make that decision, I can influence the dependent variable, which is
Sorry, Manmeet, we need to go to the second discussant.
the eligible beneficiaries who are getting
Manmeet,
benefits.
we need to go to the second discussion, please. So, Dr. Abhay.
Yeah, very quickly because the time is there, not there. Manmeet, just to improve upon the paper, 2-3 quick suggestions. You conceptualized it very well in the beginning. You started it very well, but your execution was not up to the mark. I see that when you go to the execution part, that still requires a bit more work. So maybe you can work around that. Secondly, as Dr. Thomas was also mentioning, whenever you are working on any indices, it's very important to rationalize the choice of your indicators, and that part is also not there. So maybe you can draft a section, rationalizing the choice of your indicators. So thirdly, on the mapping that you have done, this choropleth is a very interesting and intriguing kind of GIS techniques, where if you take it to the tertile, you will see a completely different pattern. But when you take it to a quartile or quintile, it will take you to a very different kind of pattern. So you also need to rationalize why you are taking the tertile and why you are representing it to that. So these are the 3 quick comments to improve upon your paper. Over from my side. Thank you.
Thank you, Dr. Abhay. I mean, I echo those sentiments. I'm not going to, there are a few comments, but in interest of time, I'm not going to give feedback on that. Just one suggestion: when you're presenting, would request you to use appropriate font size because it wasn't visible. So I had read the paper, so there was understanding. But if I was just hearing it, it was not visible, and B, when you talk about a research paper, it is more interesting to know details, and that details were not captured in the PPT. So those were the 2 presentation style paper comments. Happy to share with you separately over email. Thank you very much.
So we'll improve on these areas.
Sure. Quickly moving forward to the next presentation, which is on identification of rural growth centers using night light intensity. Would we be sharing the screen, or would the team like to share their screen?
Please.
So who would be presenting?
Only myself, Satish Dul from the team.
Sure, sir. Just giving you the presenter rights.
No, you can share it. That's all.
Yeah, okay. Sure, we'll do that. Just give us a minute.
Sure. So meanwhile, I'll just introduce myself and give you a small context about my topic. So myself, Satish Dulla, I represent Rural team here. As you see, my topic is about identification of rural growth centers using nightlight intensity. In order to give a quick context, as you can see, like the scheme for providing urban amenities in rural areas, or SAGI, Sansad Adarsh Gram Yojana, or urban mission of any of these sort, it was a great belief that we do have schemes for rural areas separately and urban areas separately, but there is always a continuum which exists or which has urban features, but still it is categorized under rural areas. So the word comes up as rural plus urban. And since from second planning time onwards, there was a belief that if we can give small push to these rural areas, which is having urban features or having a potential, that development can be triggered, and that
Satish,
area or region could act as a
excuse me, Satish,
yeah.
could you please place your microphone in a better position, because there is some disturbance on our end that we are not able to hear you properly. Yeah.
Is it
Could
fine
you
now?
please say? Yeah, it's better now. Thank you. Continue.
Thank you. Thank you. So the belief is that we need to trigger, in order to just stimulate the development in that region, we can give an additional support to those potential regions so that they could act as a kind of vehicles or growth engines of that particular area and support the other rural areas nearby. And this idea was continuing in the name of different schemes, but all the schemes are going shut down like one by one. And then again, after a few years, it got replaced with some other scheme. Again, with some modifications. Similarly, Pura 1 is finished, Pura 2 is finished right now. We are also done with Shyama Prasad Mukherjee Rural Mission phase 1. So this is a criteria which is on the left side. No, please go back to the previous slide. So the left side one is something like the criteria that they follow for identifying those rural growth centers.
Satish,
But you
just give us a
see
minute.
the major.
Satish, we can't hear you
Sure.
properly.
So
So
please turn your video
Okay.
off and try again.
Am I audible?
Try speaking something so that we can confirm if your audio is
Am I
clear.
audible now? Hello.
Yeah, you're audible now. Yeah,
Wonderful.
please continue.
So yeah, sorry for the disturbance. So here is the criteria which we currently follow for identifying the rural growth centers. Here the emphasis is given to the population and some parameters which demonstrate economic potential of that region, but somehow that is not satisfying.
Satish,
And here are the areas of improvement that are identified in the current.
Mr. Satish,
Yes.
I think we'll come back to your presentation in the end.
Yes.
We'll go on to the next presentation right now.
so
Really
try
sorry.
and see your bandwidth from your side, please.
Sure.
Sure. Thank you. So moving on to the next presentation, which is by Mr. Aryan Jain, which is use of geospatial data to enhance planning for citizen-centric infrastructure development. Aryan, you requested to be made the presenter earlier.
Yes.
Yeah, we'll just make.
Yes, I think I have presented right now. Yes, I have. Is my screen visible?
Not yet. Yes, it is.
Okay. Hello.
Yes, please start. Your time starts now.
Okay. Good afternoon. I'm Aryan Jain, a student of grade 10, and I'm going to present my paper on use of geospatial data to enhance planning for citizen-centric infrastructure development. Governments are tasked with defining administrative divisions for cities which determine factors affecting day-to-day life in a city, from infrastructure to utilities and services. However, it is often true that boundaries of administrative divisions do not necessarily reflect a real world division in the way people actually reside geographically. This, on occasion, could impact last mile infrastructure planning and delivery of key services like transportation and water distribution. This project aims to compare districts' administrative division with real world characteristics such as population and street density to highlight gaps that could assist administrations in improved data led planning and evaluate if the use of geospatial data could drive efficient and equitable citizen centric infrastructure planning. In today's world, the where dimension is becoming fundamental to all decision making. Governments today, more than ever, need to know where their citizens are and to be able to plan better for an infrastructure. In this context, geospatial data has emerged as a key enabler to plan for citizen services. In this paper, I have classified districts based on real quantitative geospatial data arrived from NASA Earth repository and the same has been overlaid on administrative boundaries to evaluate how real-world characteristics of districts over or underflow their administrative divisions. There are two main questions which my paper answers. First, what is the disparity between real-world boundaries and administrative boundaries? And second, what is the disparity between infrastructure distribution and population density? To compare administrative boundaries with real-world characteristics, I used two datasets to assess their extent of relevance. Population density data was taken from NASA Earth data, the street map data was taken from OpenStreetMap, and the programming language I used was Wolfram. As the first step, I imported population density data using the NASA Earth API and plotted the same on a map. For this, I shortlisted the state of Haryana for analysis. The step 1 map shows the population density split of the state of Haryana. The data showcases real-world characteristics in terms of where the population resides across the state. The darker shades of red highlight higher density of population. Towards the yellow side, it is a lower density of population. Next, I do the boundaries based on the density clusters to earmark the real-world boundaries. To achieve that, I increase the contrast and enhance the colors as shown in step 2, post which I use the edge detect function to plot the density clusters as shown in step 3. The next step was to plot the district boundaries as defined by the government, which I took from OpenStreetMap, and then I overlaid the same on the density clusters. This is the final map where the black lines show the real-world boundaries, where the population resides, and the white lines show the administrative boundaries as defined by the government. This overlay maps helps visualize the differences between the administrative boundaries and the real-world boundaries. I then quantified this deviation. As can be seen in the given graph, the population density is very uneven across the districts. The next step was to analyze if governments factor this difference while planning their resources. So continuing with the analysis above, I used street density parameter to draw a comparison between the population density with the density of streets in the district. This was done by calculating the percentage of area covered by the streets as against of the total geographical area coverage. To do this, I pulled the polygons as well as the street maps of the districts from OpenStreetMap. Once extracted, I converted all the streets to one color and the rest of the map to another to uniquely identify all the streets from the rest of the district. Then I calculated the street density by finding the ratio of white pixels to black pixels. The same was plotted on a graph, and as can be seen, the percentage of street data as comparison to the total district area varies from as low as 3% in some districts to as high as 17.8. The final step in the analysis was to arrive at the per capita street area of the district. To understand the same was in line with population density. This was to check if administrations were building streets in line with the population density. I plotted the per capita street area graph on a district map, and as can be observed, there's a significant variance between population density and street density. This shows that there's a significant scope of improvement in planning the infrastructure development in line with real population zones. In
Aryan, your
conclusion,
5 minutes are up. Please wrap it up quickly.
yes. In conclusion, the administrative boundaries are often invariant to the real world patterns of geographical pockets where the population resides. This results in an inequitable distribution and deployment of resources and often overexploitation of resources in some areas. As can be seen in this paper, geospatial data can become a key enabler to plan for citizen services, evaluate emerging trends, and help plan key infrastructure development like transportation, roads, electricity distribution, water distribution, etc. From a future enhancement perspective, I aim to add the following. First, create a model to predict the future road density requirement for a given location. Include more factors like terrain, nightlight, etc. in the process, which will help to create more accurate boundaries. And finally, to create a computational standard for drawing administrative boundaries. Thank you.
Thank you so much for following the time limit. And now we'll move on to the discussion. We'll start with Dr. Thomas. Please.
Aryan, can you hear me?
Yes,
I
sir.
believe so. All right. Very interesting. Congratulations to you. I must congratulate you immensely because you're one of the youngest presenters I've seen with a nice idea just come out, right? And in fact, I have not much comments to follow because this does not come under purview of economics. But see, you have always, you also commented about the future enhancements, which also talks about the population projections, which is what is in my mind. But since you have already talked about it, I don't have anything much to say. I hope this project really works for you, and it could be scalable. It could be able to create waves in the country. I wish you all the best. First of all, right? Brilliant, right?
Thank you, sir.
Thank you.
Calling upon Dr. Abhay Kumar for his comments now.
Thank you, Aishwarya. Yeah, I totally echo the sentiment of Dr. Thomas. We must at least give a big round of applause to this young boy, who has really had the courage to compete with all the other presenters. So thank you and congratulations, Ayush, for coming to this stage. Yeah, coming from now back to the feedback side. You see, this is basically a call for the research papers for data autonomy. So the point that you are trying to make is very valid, and it's very not only valid, but it's now started getting used by different ministries, by different government agencies, not only at the central level, but even at the local level. So I have my land records now digitized at the ground level. Earlier it was not. It was we had a different maps. So from that perspective, the government has realized the potential of GIS and they have started using it. And you have nicely emphasized the fact that this particular tool, which is very efficient tool in also enhancing and augmenting the public infrastructure. So thank you so much for highlighting that point. But coming from the paper side, the research paper has a kind of structure, which we will definitely try to help you out with coming out into a kind of a very thematic paper, which can get published into either a book that is going to be published by DMU, I'm not sure, or in any journal. So from that perspective, it requires a bit of more work to organize it in a way, because you need to have a objective of the paper, what are you trying to achieve, and all those things needs to be tweaked a bit more in your paper. But huge thanks and congratulations to see your work. Thank you.
Thank you, sir, and I'll keep all the points in mind.
Thank you. Thank you, Doctor. Sorry, you're on mute, right? So thank you, Dr. Thomas and Dr. Abhay. Congratulations, Aryan. Very interesting insights that you brought in. I would suggest, as Abhay mentioned, it is the building block to take it to a proper publication. But the basic edifice is there. Maybe you would want to look at its implications of what you are doing. So, for example, you would want to having road density does not mean mobility. So maybe overlay that parameter. Maybe look at some
Yes, sir.
socio-economic indicators and then see if that socio-economic indicators are mapping to the road density. And third thing is it might be interesting to look at nightlight data population correlation with the way you have organized the population density and see if there is a delta and conduct a t-test if we can. So
Yes.
again, congratulations, and we would be glad to support you in your journey of publications collectively. I'm sure both the discussants as well as DMO, if you need any support. Thank you very much.
Thank you, sir.
Moving quickly to the next presentation, Mr. Satish, could you please?
Yeah.
Yeah. So, would you like to go ahead and present now?
Yes.
Would you like us to share the presentation, or would you be sharing the presentation from your end?
No, please present it for me. I'll just switch off
Sure.
my camera and continue with my mic alone.
Sure, we'll do that. Just give us a minute.
Thank you. Yeah,
So
thank you.
the yeah,
Please wait
start.
a second. Next slide. So as I mentioned earlier, the left side one, the latest criteria that we follow in Shyama Prasad Mukherjee Rural Mission to identify the potential growth centers. But my question is, are we really identifying the real growth centers? Because right now the importance is given to the just presence of population and some economic factors alone. If you see the left bottom, some 5% and 10% weightage is given to some government schemes or 15% without any proper explanation. And there are like during the course of time during the study, I also identified the areas of improvement in the current criteria that we follow. That is, suppose there is a plan which was made in 2021, but the data that we follow belongs to census 2011. So that kind of problems are there in it, and we can definitely improve ourselves. Similarly, there are reliability issues, accountability issues, because some person at ground level will simply put some number in for the population and other factors that we are asking for. So the more and more human intervention is maximizing the human error as well. So we can even work towards minimizing the human error. Similarly, there are some cases where a particular area is developed under a rural this urban scheme, but all of a sudden just being it is just outside the some urban area, and while expansion it got converted into urban. There are some issues like whether that area can be accounted for in the rural region or not. Some kind of issues are there because of urban to so rural to urban conversion. At the end, and the final key intervention that can be done is technology intervention, because so far whatever the um, factors that we accounted for, whatever the data that we collected from the ground level and district level, all those has to be compiled, and somebody has to sit and do this analysis and suggest the states and districts come up with some growth centers. So these are the areas of improvement. Uh, Please go to the next slide. So my main objective is to define or formulate a growth center identification criteria, which is more technology driven, following the latest data, easy and reliable for the ground level persons, and emphasizing more about economic development, reducing the human error, and make it more and more effective and efficient. Next slide. So with that, I started identifying some potential indicators for the same. For example, out of like I started with 31 indicators, then next slide please. So I started with 31 potential indicators, out of which, based on the accessibility and some kind of updating frequency, I shortlisted around 9 to 10 indicators like population and density, which can be collected from either UIDA or Mishran or Facebook data. Good. Similarly, the second one is economic clusters. The latest one that government I mean, it can be like any cluster, the cluster level approach. One example is SFURTA clusters, which were defined by MSME. Similarly, micro, small, medium enterprises, even industries and industrial parks can also be added to this one. There is a program called Udyam, where all those enterprises has to register themselves, so that the data can be used and mapped to just check in which region what is the count of these enterprises, and what, so that we can get to know the potential of the tree. The electrical consumption, it could be like uh, per capita consumption or the total consumption of an area. Similarly, satellite images are there, mission the data are there, GDP, GSDP, local groups, economic hotspots, whatnot. So all these are something like putting some emphasis or replicating or reflecting the potential of a region, so that if we give some support to that in the form of either convergence of the schemes and good planning component, so that these regions can be groomed as a well-developed regions for that particular region. But the thing is like the rural areas doesn't have all this infrastructure or even human resources to understand and apply all these factors at the ground level. So as just discussed by my previous presenter, we need to have some kind of factor which should be very easier and which should be easily applicable. So please go to the next slide. Literature suggests that there is some kind of relationship exists between one and the other parameters. Something like energy conversion and GDP has relation. GDP and industries has some relation. Nightlight and economic growth has, next slide please. Nightlight and economic growth has some relation. Similarly, human development index and nightlight has some relation. So, but all these relations are based on some kind of studies, specific studies in the other countries. I want to test it for India as well. So I took it up based on seeing the emphasis on nightlight. I tried to map the other parameters and check the relationship with the nightlight intensity of 2019. Next slide, please.
Satish, your 5 minutes
what-
are up. Please wrap this up quickly.
Sure.
Thank
So
you.
this is all about nightlight intensity, where some images or low light images are taken and some corrections are done. Finally, we come up with some kind of maps that are shown in the next slide. Next slide, please. So here you can see how India looks like in 2012 and 2019. We can easily spot the difference and what kind of differences advancement took place in between this period. You can ask me why 2019? As I said, latest data is available even for 2021, but 2019, just because after 2019, due to COVID lockdown, the picture is different. So I just wanted to have my study more stable one, and I'm trying to just formulate it. So I just stick with the 2019 data itself. Next slide. Now, as I mentioned, I wanted to just check the relationship between nightlight intensity and the other parameters. These are individual parameters and corresponding graphs. Next slide. You can directly see in the table below where all the correlation coefficient are more than 0.9 most of the time. So there we can just conclude there is a strong relation exists between all the other parameters with the nightlight intensity. So I took it up as a kind of proxy indicator. So with this single parameter, we can represent all other potential. We can represent the potential of the region. Next slide. Then how to use it as a how to formulate criteria. Taking nightlight intensity, we can just map them down. Then we should classify using natural breaks, so that either 5 to 10 classes that can be classified. Then we can just put map out or put all the other potential indicators that we want to map down. Then we should divide
Satish,
all the area into clusters. Yes.
I'm sorry, but you have to wrap up your presentation in the next 30 seconds, please. We have already given you an extension.
Definitely.
Thank you.
Definitely. Thank you. So the whole area is converted into cluster and non-cluster regions. Then the growth centers can be directly identified based on our visual decision itself. Next slide. I tried out the same on some particular district called Ahmednagar in next slide, please. Yeah, Ahmednagar, where you can just see all those things are mapped. And the right side one, I tried to highlight the growth centers in blue color. Next slide. The similar one can be just seen in the 2012 and 2019. This is something like the identified growth centers can be ranked based on this criteria. Next.
I'm sorry,
so
Satish, but we'll have to stop now.
Done.
Satish, thank you so much.
Yeah.
We will have to move on to the discussion now. Thank you so much for your presentation.
Sure.
So, Dr. Ashok, we would like you to share your comments first for this presentation.
Yeah. Thank you, Satish. Quite interesting work. It's nightlight intensity as a proxy variable for economic growth or any kind of allocation. That is what I believe. Just one question: how did you arrive at that weights basically? What is the logic behind this? Is there something the weights these are the weights should be used, or more or less is there a method that you
Sorry, sir, I couldn't hear you. I missed it out.
What is the criteria for using the weights you have used some weights, right? 30, 20, etc.
Yes, sir. So that's the, like, there is no logic as such, but while I was working in the ministry, that's kind of other indicators that we left behind, right? Because we took nitrate intensity as a proxy one. Other indicators can be just given these weights so that we can make some kind of growth center ranking, which can be like followed by all the districts uniformly. These are just based on the mutual discussion with the other officers and consultants in the ministries. Am I audible?
Yes. I lost you, but that's get the answer. That's it from my side. Thank you so much.
Thank you, sir.
Dr. Abhay Kumar, would you please like to share your feedback on this?
Thank you, Aishwarya. Thank you, Satish, and your colleague, Mr. Jeet and Bakulji. So a very interesting, in fact, idea to develop this paper on. So I'm aware that there are very few studies which has been based upon the nightlight intensity. So I'm glad that you have taken up this subject as a matter of your research. So thank you for that. Yeah, you have tried to use it, but I suggest you take some more literatures because, I've seen you taking a very few literatures and try to, of course, nightlight, as you rightly said, that is it is having a very high correlation with many of the economic development indicators. So that's a fact, but also try to look at the different nuances of it. So for instance, uh, let me cite an example. Like nightlight intensity is just a kind of also a matter of the availability of the electricity. So in Bihar, I tell you an example. The total electricity consumption was 1400 megawatt for some time, when Delhi's electricity consumption used to be more than 5000 megawatt. But all of a sudden, some of these big electricity power plants and all have been installed, and all of a sudden the electricity consumption went up to almost 7 to 8,000 megawatt. So you'll have to look at all those smaller nuances also on how it impacts and how it looks at. Otherwise, you have done a wonderful job, and really appreciate the job that you have done. You can fine tune your paper, and then that's a wonderful paper to be published. Over from my.
Thank you,
Sir.
Doctor.
So, sir, may I add something to that? So,
Yes, please.
as you mentioned, it's about availability of electricity. Right now, like I took this nitrate intensity is not just like a 1 day or 1 month kind of thing. It's been like seen for the whole year, and it is calculated as a kind of average. So I hope all the minor, whatever the other factors that can be accounted in this average, I guess.
Thank you. Thank
So,
you.
Satish, I have 2-3 comments. While you look at the delta between 2012 and 2019, you might also want to factor in grid electrification, and how do you account for grid electrification and take it out of the overall analysis from luminosity intensity. So that is one point that you might want to do if you have not considered that. Second one is also look at correlation, or if there is an endogeneity between the various parameters that you're talking. If because the population is going up, there is an implication on other socio-economic development. So look at or other parameters going up. So that, just do a check on that, and as it was suggested, maybe that would be supported by additional literature review, supported by analysis that you would do modeling. And third one is the objective of Nightlight is not to replace surveys, but it is to have lead indicators. So if we are going to have lead indicators, what lead indicators for what? So that when we look at Nightlight data, we should be able to predict with appropriate confidence level, the actual parameter that what we want to analyze. So that should be more articulated, better articulated in the paper. These were my 4 observations. Thank you.
Sure, sir. I'll definitely incorporate all these recommendations in the paper. Thank you so much.
Thank you. Moving on to the final presentation for today's session, which is Interstate Variation in Performance of Pradhan Mantri Employment Generation Program. So, we have shared the screen. We would request the presenter to start presenting.
Your time starts now.
Thank you, Ashwarya. Thank you, everybody, for joining. The title of my paper and the presentation is Interstate Variation in Performance of Pradhan Mantri Employment Generation Program. Next slide, please. A brief about the program. So, PMEGP is a central sector scheme which comes under Ministry of MSME, Government of India. And the objective of this scheme is basically to promote employment through promotion of to financing micro people to set up micro enterprises. So there are two components of this scheme. One is the government provides subsidies to bank to provide loans for setting up micro enterprises to the implementing banks, and also it promotes backward and forward linkages of this scheme with other schemes. And the broad objectives of the scheme is income generation, and second is employment generation via promotion of enterprises, basically through self-employment. Second slide, please. Now, a little about how this scheme works. So basically, the implementing agencies are basically Village, uh, Industries and Commission, Coir Vikas Yojana, which are uh, autonomous arms within Ministry of MSME. So proposals goes to the implementing agencies, then they scrutinize and recommend to the implementing banks, and then the banks appraises the proposal, and then the loans are sanctioned. So basically, there are two points where rejections can happen. One is at the implementing agency level, and second is at the bank. So my whole paper revolves around how these rejections are leading to interstate variation in the performance of this scheme across states. Next slide, please. The objective of my study and also the hypothesis is to study the impediments to scheme execution from the process side in terms of selection of projects, and also to assess its effect on overall success of the scheme across various states. So after analyzing administrative data and also triangulating it with periodic labor force survey 1920 data, what my hunch and also in technical terms hypothesis is, the states where higher proportion of applications are being accepted are the states where there are more projects to assist per every lack of labor force. And also states with higher projects assisted per lack of labor force gets higher credit support, and states which get higher credit support also have higher benefits of this scheme flowing towards them in terms of employment generation. Next slide, please. So the key indicators which I have used and my whole paper revolves around FY 2021 is the projects assisted across states out of the total application, loan amount sanctioned towards the applications which are accepted, margin money released, which is basically the subsidy which governments provides to the banks, employment generated by the assisted projects, and also I've created a variable which is application acceptance ratio, which is nothing but when I divide projects assisted, basically applications approved upon the total application received for that year. And I've normalized all the important variables like loan amount, sanction, margin, money, employment generation by normalizing it by labor force of that. Next slide, please. And the databases which I've used for the analysis is data which is administrative data which is available on the e-portal which is maintained by KVIC for this particular scheme. And also I've triangulated it with the PLFS data 1920. Now, findings of my paper are that this so we see how the benefits are flowing across various social classes and genders across states. So on the left hand side of the graph, we see that in Mizoram, Tamil Nadu, Andhra Pradesh, a lot of units which are supported by these schemes are by women. But in other states like Uttar Pradesh, Chhattisgarh, and Uttarakhand, these fall down to well below 30%. So there are interstate variation in terms of benefits which are flowing across different classes and genders. Next slide, please. And also now, if we look at this graph, we look at on the axis, we have employment generated through scheme per lack of labor force, and also employment rate on the y-axis. And we see that common sense would say that such scheme, the benefits of such scheme should flow disproportionately towards areas which have higher unemployment. But as we see from this graph, no such thing is happening. For example, in states like AN, which is Arunachal Pradesh, where unemployment is high, has lower employment generated, where states like Tripura, where unemployment is low, which is TR. So, I mean, there's no as such correlation, or there's no evidence of the benefits of this scheme is flowing towards states which have higher employment. Next slide, please. Now, also, if we look at the amount flowing towards ADP districts and other districts, we see that on the left-hand side, the green green bar represents amount flowing towards non-ADP districts, and blue are the ADP districts. And we see that ADP districts, which are most backward districts in some sense, are receiving less assistance from this scheme. Similarly, on the graph on the right hand is the difference between the average money disbursed in ADP district, and we have subtracted from that amount towards other districts. And we
Charlo,
see that.
this marks the end of 5 minutes of your presentation. Quickly wrap this up. Thank you.
Thank you. Now we see that the more amount is going towards other districts rather than the ADP districts, poor districts. So in last two graphs, we have seen that more amount is going towards already richer states and districts and the poor districts. Now, why I focus on application acceptance ratio, and why I see that this variation is because of the variation in the application acceptance ratio. Last slide. Next slide, please. In this, we have seen that states with higher application acceptance ratio are the states which have higher margin money disbursed towards them. Also, these are the states which have higher employment generated per lakh of labor force. So this is evidence that variation in the application acceptance ratio across states are creating variations in the benefits of this scheme which are flowing towards this state. Next slide, please. And on the left-hand side, we have seen that this application acceptance ratio varies across states. In the poorer states, especially like Bihar, etc., 90% of the applications are rejected. In Manipur, 92%, Assam, 88%, while in Mizoram, only 60%. So there are a lot of variation. And overall, if we see since in 2021, 85% of the applications were rejected. And the top rejection regions are project not viable, and projects are not feasible, profitable. Targets have already been completed. Basically, funds are over. The area of the enterprise were out of service area, and few people were also unable to submit the documents. Next slide, please. Now, basically, the reason for lower acceptance region varies across state. One point to note is that on the left-hand side, the out of the total applications rejected in West Bengal, Odisha, Chhattisgarh, and Jharkhand, 42%, 33%, 21% were rejected because the projects were not profitable. So basically, what we are saying that anyways markets are not helping them, and also the government is not also helping these poor states. Then who will help them? Next slide, please. Now, also one reason also was the target. Target was over. The funds were not available.
Charlo, you just
So
have 30 seconds to finish your
yes,
presentation, please.
thank you. So one of my most important recommendation is that there's a need to look at the budgetary allocations which is going towards MSMEs. So MSMEs are one of the major building blocks of this country. But if you look at the fund allocation, the MSME comes in the top bottom corner. MSME somewhere where the x-axis shows 30. So basically, this is the scheme where around not even 200 crores are given to a particular scheme, while the government-wide average is 1612. So I think there's a good look should be given to the budgetary allocations which are flowing towards MSME. Next slide, please.
Thank
I'll
you.
take just 10 seconds.
Yeah, thank you, Charlo. But we'll have to stop
Okay.
now due to paucity of
Okay.
time.
Thank you.
Thank you.
Thank you.
Yeah. Calling upon Dr. Abhay Kumar for his comments now.
Very nice work, I would say, Charlo. In fact, to be honest, when I was looking at the theme of this call for papers, I was trying to look for some of the papers which are using the administrative data to work upon the papers. And this is one of such paper which I have found here. So thank you for using the administrative data to work on the papers. So, whenever we discuss about the data-a-thon or data-related papers on the monitoring and evaluation, we always try to look at some of these programmatic data to reflect upon the program. So from that perspective, your paper is very rightly, placed in this particular call for papers. Thank you so much for your good work on that. You have also analyzed the data very nicely, but I think you could have taken few more indicators. I have seen only, you have tried to look at the acceptance of the application as one of the indicator under which you have tried to look at. But you could have, I don't know how far the administrative data has permitted you to work on, but if the data would have permitted, I think you should have gone ahead and you should have looked few more indicators to look at the performance of the program. So that would have added to the work that you have done. So that is my comment on the analysis and others. But on the looking at your paper, I think it is still unstructured. I think you worked on it very rapidly. So I think you need to put some more time to refine it and then to put it into a paper format, because I see some of your results and discussion and findings is just scattered. So maybe you can organize that and you can just try to build on that as part. But yeah, thank you so much for your work.
Thank you, sir.
Charlo,
Now I would like to call upon Dr. Ashok Thomas for his comments.
Yeah, sorry, internet is having a problem right now. Can you hear me?
Yes.
Quite interesting work. At the end of the day, you're telling either it could be due to the lower funds or is it could due to be the lower awareness. We end up having or low qualifications. How about looking at those applications which got selected? Because when you talk about it's not a fit, it's not lack of awareness. Apart from that, those applications were not viable. So where the applications got selected, you consider something like opportunities growth in certain sectors, profitability, and employment rates, etc., could be quite interesting to see that why compared to others, basically. That's one of the suggestions. Second thing is that when it comes to say, higher fundings compared to lower fundings is which exists in states. You can basically check on that. There are
I'm not able to hear Professor Ashok Thomas.
Dr. Abhay Kumar, we are sorry, Ashok Thomas, we are not able to hear you. I think could you please try connecting again?
Okay, maybe I'll just wrap up with the comments. So Sharlu, this talks about, your paper talks about supply side, but for development, it is a combination in addition to the agency of the individual MSME. And I think that also has to be looked at, and that gets reflected in the amount of applications that got rejected. So possibly implication is what steps needs to be taken to build that agency. So you might want to look at that. And I second and support Abhay's comment on better flow and thought through of the overall analysis with looking at appropriate model that you can build on that. But it's a good starting point. Thank you very much.
Now I would like to call upon Dr. Abhay Kumar for his comments on the overall presentations and the session today. So thank you so much, Charlo, for presenting, and all the participants. Thank you.
Thank you, Aishwarya. Yeah, so it was a very enriching session. In fact, very learning opportunities for me as well, because we have seen a number of good work and amazing work. In fact, very new thoughts, new innovations in terms of utilizing the newer data sets that are available to us, and how do we use those data sets for the the development of this nation. So from that perspective, I congratulate all the writers, authors, and a huge round of applause to all of you, because all of you have done a wonderful job. So thank you so much for it. Overall, all of these papers which have now been shortlisted are really good papers. It requires a bit of tightening, bit of work, more work, and then it's ready for publication. So I'm not sure how DMU is planning to take forward these 6 papers, but would like to know more about it. But I'll be there to extend any possible support to work on not all the papers, but on few papers, because of when given my own expertise and experience, I'll be very happy to support in terms of finalizing some of these papers for the publication. So thank you so much, all the presenters, and I have already provided individual comments to each of the papers, so no more going further back to those comments. So thank you over.
Thank you, Abhay, for your time. Thank you very much. Thank you all the participants for presenting. It was wonderful hearing different insights. We would like to, if there are ways we could support you to take it to an appropriate, what we will do is that we will send out an individual email separately to each one of you, indicating who possibly could help you in giving deeper insights, and how you could tighten and sharpen the paper towards publication, and then you could take your journey forward towards academic research. Thank you very much for participating. Appreciate it.
Yeah.
Back to you, Aishwarya.
Yeah. Now I would like to call upon Meenal, who will present the closing remarks for the session. Thank you.
Thank you all for participating. It was indeed a very enriching and informative session. I would deeply like to thank Professor Ashok Thomas and Abhay Kumar for sharing their views and feedbacks on each and every presentation. We would like to show humble gratitude for supporting DMEO Niti Aayog. I would also like to thank all the participants, and we look forward for further collaborations in future for similar projects. We shall be sending you the certificates of participation over the emails. I would also like to thank the Global team and the audience to make this event a very successful event. Thank you all.
Thank you. Just one point. Due to paucity of time, we are not taking Q&As, but we'll try and email them to the respondents and have their feedback to each one of you. Thank you very much.
Thank you.
Thank you so much.
Thank you.
Thank you. Thank you, everyone.
And with this, we close the session for today. Thank you very much.